Welcome to the hit podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As always, we are dropping into your feed on Tuesdays. Like, subscribe, share, heck, tell a friend. But make sure that you keep coming back, because what we're trying to do is put together bite-sized, digestible, curated content of things going on in the space for you, bring it all together, and make it a fun, worthy follow for you. With all that being said, this week's episode is brought to you by Montage Insurance Solutions. And without any further ado, let's get right into it. We have with us here Zach. Zach, how you doing, buddy?
I'm doing good. How are you, Toby?
Good. Thank you for coming out. So this week's episode, what I wanted to do was talk about some augments, alternatives, some things going on in the space of healthcare, but maybe take a unique angle on this. And I thought I would bring out someone that's got a really creative take on this. Your company, Kingdom Legacy Benefits,
yes.
KLB, if you guys have, by the way, noticed, not only fans of the show, thank you very much, but also have a great product.
Definitely.
Okay. So one thing I want to get into is the idea that some groups, they've got their core, their medical, dental, vision, but they're still bumping into completely solving the puzzle of what their best healthcare piece is.
Right.
Right. And what you guys bring to the table are M.E.C plans.
Correct.
Do you mind talking to me a little bit about kind of the design or the thought behind that?
Yeah. So M.E.C plans are relatively new into the market. Funny enough, they actually started here in California, right? So about 12 years ago, they started up in Northern California because you guys have that individual mandate, right? You guys still have it to this day.
You guys
right?
meaning not you Texans over
yes,
there?
Where us here in Texas. I'm from Texas. We do not have that over there. So it's actually crazy that M.E.C started here in California. And as you said, M.E.C stands for minimal essential coverage. So what we are is we're a carrier. So we are a supplemental health insurance plan that helps supplement your major medical and all of those high deductible plans that you have. You can kind of supplement it with what our plan offers.
Yeah. And so that's an interesting kind of initial take into this. And we'll dive down a couple of different rabbit holes. But when you say supplement, how much of the time do you see employee? So on an employer level, I absolutely think this supplements the healthcare portfolio where you've got your core medical, your major medical, and you've got this M.E.C plan.
Right.
From an employee standpoint, do you often, sometimes never see employees that take your M.E.C plan and a major medical plan?
Yeah, so a lot of the times we actually will see them take both.
Yeah.
So it depends on what type of health insurance that your company is offering to you. So if your company is offering you a high deductible health plan with a really big out-of-pocket expense and type of like an HSA plan where you have to meet your out-of-pocket until it covers 100%, that's where you're going to want to supplement our M.E.C plan.
Right.
So big thing with our M.E.C plan is it has your co-payments for your primary care doctors, if you need to go see a specialist.
Meaning no deductible, right? Just right off the bat.
Yeah,
co-pays.
right off the bat, which is amazing. If you need prescription drug benefits, our plan has that as well too. You need to go to the urgent care, get lab works, x-rays, things like that. That's where you want to supplement with the M.E.C plan alongside with your major medical plan.
So you're saying it pairs well in certain instances, and even more specifically, times where the employee might have a large deductible levied upon him or her. And you specifically mentioned HSA. And just to back that up, it's because, I imagine you mentioned it because HSA plans by law, everything is subject to the deductible, right? There's no first dollar copays. There's no first dollar prescriptions. So you've got some employee that's got a sizable threshold before their major medical will perform.
Right. Correct.
And so you're saying those are the ones where they pair really well.
Yes, exactly. Yeah. So that's where you want to pair your M.E.C to help offset those costs with like an HSA or high deductible plan.
So that member goes in and they go, look, I just need to see a doctor real quick. It's nothing major. I want to jump in. Maybe they pull out their M.E.C card?
Yes. Yeah, exactly. So what's awesome about the M.E.C plan is it is insurance, right? So they do get an insurance ID card in the mail. That is what you present to the doctor. If you need prescription drugs, you need to go to the pharmacy, you present that to the pharmacist. If you're going to get lab work, that's where you present to the lab work place as well too. That's what you're going to present when you're going to the doctor.
And that's a good point about the card. I'm glad you mentioned you literally do get a card.
Yes.
Sometimes people say like your card, and it's like, do you mean that figuratively or do you literally mean an actual ID card? When they present it, what like network might it be tied to, or what doctors might they be able to see?
Yeah. So what's amazing about our plan too is we are a PPO plan, right? Meaning, as long as you are in the network, and our network is the First Health Network, you can go to any provider that accepts the First Health Network,
which is a large national,
very, very large national network here in the U.S.
Is that the same for the prescription? I imagine it's probably a different network.
Yes. So for prescription, it is OptumRx, same huge large network as well too, nationwide as well.
Yeah. So then the members go and they in an instance where they would have had their deductible, they present your guys' card, and that's how sometimes they pair together. There have been times, and we work together in cases like this, in full disclosure, where based on maybe the business nature of the specific client, they actually roll these out to touch some of the employees that had historically been a part of their organization but had not had any insurance. So you've got a whole swath of whether they're part-timers or lower earners. Maybe talk to me about that angle.
Yeah. So what's amazing about the M.E.C, it is very, very affordable, right? So to the average person, to the average worker.
What does that mean? What's a range?
Yeah. So we're talking about, our blue collar workers, right? Those blue collar workers that we know are working hard in day in out. That's who our M.E.C is good for, because it's very affordable. That can't maybe necessarily afford a major medical plan that's, $800 a month or something like that.
Because this one might run 80 to 120 something in that range?
So max, you're looking at anywhere from $40 a month all the way up to $100 a month, depending on the type of plan that you choose.
And then if the employer chooses to subsidize or not, then that 40 to 100 turns into 0 or 20 or 50.
Yeah. So what's amazing is we have a lot of companies as well that they see the value that this offers into offering it to their employees. So they'll sponsor the plan 100%.
Right.
Which is amazing as well.
Well, and that's interesting too, because like you said, now it's not major medical, and I've actually seen you in the room be clear with employees that it's not major medical, but in cases where they might have done nothing, because let's say the cheapest plan for them was, like you said, $100, $200, $300 after the employer subsidy. So it's like, gosh, do I as the employee have, call it $150 a month to buy the major medical plan? And if for a swath of our employees, that answer was no, and now they have no insurance, your plan comes along and offers them something. But for the employer to charge that employee $150 for the plan, it might cost the employer $200, $300, $400 per head.
Correct.
So if they subsidize this $80 product, call it just to throw a dart in the middle, now not only is the employee got a $0 plan, it's free to the employee, but it's saving the employer a person that might have jumped on their major medical.
Yeah, exactly. So it's very good on a business standpoint as well, too, what it can do for a business as well. Now, a big thing with the M.E.C also is it's used for compliance. So on a compliance standpoint, if you're an ALE, which stands for applicable large employer, right? Having the M.E.C helps protect you against penalty B. So there's 2 penalties that an employer
within the Affordable Care Act.
Within the Affordable Care Act, yes, sir. That an employer can get if they do not offer major medical to their employees, right? So our M.E.C helps penalty B of the Affordable Care Act by offering it to your employees because it's affordable as well.
So what you're talking about is what they would sometimes also call the employer shared responsibility provision. So if you're an employer out there and you're trying to look and see what are they talking about? How do I tie this stuff together? The shared responsibility provision said to them, hey, you have to offer plans of a certain actuarial value, which this might not necessarily help, but you also have to offer plans that are affordable.
Correct.
And this is the part where you say, hey, look, we can help you with that piece because you offer a plan that's maybe free or $50 a month or...
Right. Yeah, so that's what's amazing about the M.E.C as a company to offer it to your employees.
I think we're getting at a couple of the places where it fits, right? So backing it up, we've got the employees that use this as an augment to the high deductible products.
Right.
We've got this as the otherwise uninsured employees that take this because it's better than nothing.
Yeah.
And then we've got the part where employers say, this might actually help me work on some of my PPACA, PPACA, ACA, Affordable Care Act, name du jour penalties. What types of industries, employers, size groups, like when we've touched on some of the places that you guys are a fit, because not everything's a fit for everyone.
Yeah.
But what are some of the groups or sizes, or are you a fit for everyone? I mean,
yeah, so I think it just depends, right? So we're not cookie cutter. I think
Right.
the big thing with our plan is we're not cookie cutter at all, which is amazing. So if we need to make a custom plan to fit an employer's needs with their employees, we can do that.
Yeah.
We mainly target, of course, the blue collar workers, so a little bit lower income that maybe can't afford a full major medical plan.
So what does that look like? Restaurants?
Yeah, so we're looking at restaurants, construction workers, truck drivers as well too, given that our network is through the U.S. as well too. Blue collar workers as well.
Yeah. Is there employer size? I know you mentioned the ALE earlier, that applicable large employers, that 50 plus, where you add the full-time equivalents plus full-time, blah, blah, blah. Do you fit small groups, larger groups, all groups?
Yeah, so we do anywhere from 2 lives all the way up to 2,000 lives.
Yeah.
So again, we're not cookie cutter, so we can fit any employer size in the market.
Do you say 2 to 2,000 because that's a cute phrase that fits, or do you actually cut off at 2,000?
No, so we don't cut off at 2,000.
Okay, so you go two and up,
yes,
basically.
Yes,
yeah,
two and up.
Okay. And you have those 2 nationwide networks, right? You talked about First Health on the medical side, Optum on the RX side, and some of the employers that you fit. What does it look like from an employee standpoint?
Yeah, so from an employee standpoint, it's just like your major medical, right? You're going to get your ID card in the mail. Once you get in the mail, that is what you're going to give to the doctor's office. If you need to go to the urgent care, that's what you present to your card. You have your set co-payments on the plan, and that is what you pay with it.
And those are explained to the employee, in the same sort of brochure, open enrollment style, because they're prearranged, right?
Exactly. Yeah. So they're arranged. When we're doing our open enrollments, of course, education is huge, especially with our plan and what it covers. We explain it to the employee so they know how to use it.
And again, what it doesn't.
Exactly.
Right?
Yes.
So we've drilled a little bit on like co-pays, office visits, prescriptions. Talk to me about some of the other parts of medical needs, hospitalization, outpatient surgery. What does your plan look like for a member that needs those sorts of things?
Yeah, so we offer a couple different types of plans. Of course, our first 2 plans are not going to cover hospitalization
Like
at all. Remember, we are a M.E.C. So M.E.C stands for minimal essential coverage. So that's where we are minimal, meaning if you need to go to the hospital, if I were to get into a serious accident, it's not going to cover that plan. Now, we do have our platinum plan that does have hospitalization benefits to it. Now, I say that very lightly because those hospitalization benefits are on an indemnity basis, which what that means is, you have to get hurt first or go to the hospital first, submit a claim, and then you get a reimbursement back for an allotted amount.
Which would typically be thousands, tens of thousands?
So it depends on what were to happen to you and if it's because of an illness or an accident. So you're looking anywhere from $1,000 all the way up to $20,000. So
almost like I hate to throw Aflac out there, but like a scheduled benefit sort of a thing. And depending upon what the hospital codes are, they'll get reimbursed for that amount.
Exactly.
So reimbursement is one reason why a member might interact with you guys. What about questions, comments, concerns? What does customer service look like if HR rolls this out?
Yeah. So customer service is all in-house, right? We're all written in-house as well too. We have a full team to back up. So anything for claims, anyone needs ID cards, any concerns, finding a provider, we have all of the customer service that can assist with that.
And I know we're out there chatting with some of our groups that we think this is the right fit for, right?
Yes.
And so there's obviously the consultant channel out there, but if HR folks are out there listening and want to just kind of maybe quietly kick the tires on this, is there a website? Is there more information somewhere?
Yeah, so we do have a website. It is going to be www.klbenefits.com. So it has all of our information on there. Now,
KL like Kingdom Legacy.
Kingdom Legacy Benefits. Now, all of our plans are custom, so you're not going to see prices or rates on there as well too. You can reach out to us directly, or if you are working with a broker, they can reach out to us, which we partner with brokers all the time. And we can set something up and see if it's a good fit. And that's a lot of the times too, maybe the M.E.C is not a good fit for you, right? So there's a lot of meetings that I've been with my brokers or with HRs, and this isn't a good fit. So it's just understanding what our plan does and how it can help your company.
Yeah, I think not everything is designed for every situation, but what I'm happy to do here today is dive into some of the times where employer groups have said, hey, this really fit. There was this specific segment of our population and this fit in and this helped them. And we're happy to have done this, right?
Yeah.
So, and I can speak to it because I've actually physically seen you boots on the ground, but if someone's saying, okay, we've identified when and if we think this is the right fit, but when we have this conversation, how does it look to employees? What does communications look like? What does the meetings look like? What is the collateral?
Yeah. So very simple process into implementing it, right? So if you're working with a broker, obviously the broker will do that with you and getting the process implemented. We are very big in education, right? So education is key, especially our product is special. So we'd love to do open enrollments, come out in person, speak to all of the employees, educate them on how the plan works and how to use it as well.
You come out with your blow dryer and I told so there's a guest on here, Dr. Hunter Vincent. You can go look him up. I said, listen, I don't mind being out-knowledged, but I won't be out-haired. This is ridiculous. This is the second time on my own show. So you come out physically in person yourself sometimes. Yes, and your team, and you guys are out there and you roll it out. Love that, man. So I think to end, and maybe we covered everything, but curious if someone's out there listening and they're intrigued, their interest has been piqued.
Yeah.
Is there anything we didn't touch on? Any other notes you'd want to make sure that?
Yeah. So I think more so on the employer standpoint. So big thing with the M.E.C that we offer as well too is filings. So with a self-funded type of plan, which is what we are, we offer the
technically, right? So when we're talking about, and I don't mean to interrupt, but plans are sort of pregnant or not pregnant, right? They're either fully insured or self-funded. And everything you're describing to the employee and to the member and even to the employer looks and feels fully insured.
Correct.
But the way it's filed is on a self-funded chassis, and therefore it triggers some filings that you guys help with.
You got it. So amazing thing with our plan as well too that's included is we will do the 1094s, 1095s filings and the PCORI tax. So with any self-funded plan that you offer, there is a PCORI tax that you have to file, and that's where we take care of. And then obviously you have your 1094s and 1095s showing that you are offering insurance plan to your employees, and we take care of that for you as well too.
And so if someone brings you in as a M.E.C partner, almost always, in fact, probably literally always, there's also a major medical carrier,
course,
right?
Yes.
Do you do any work or help or assistance on that? I know you're not the major medical, so you don't necessarily have to touch that, but is there value add that you bring?
Yeah. So value add that we bring is we will do all of the filings for the major medical as well too, as long as the M.E.C is in place as well.
So the next in place, you'll help with the 1094, 1095 of the other carriers as well?
Yes, sir. For anyone that is enrolled.
Super helpful.
Yeah.
How about, I guess, lastly, now that we're talking about some of this compliance stuff, is this COBRA-able? How does this look from a COBRA standpoint?
So this is COBRA eligible. So of course, if an employee were to leave, they can't take it with them as well too. And it does suffice the individual mandate, especially here in California, which is huge. It does suffice that as well. And you can put it alongside like Medi-Cali. For example, as well too, to help supplement. Because remember, this plan is a supplement, right? We're not trying to replace or take over your major medical. It's just to help aid in it.
So for clarity, enrollment in this plan, to the best of your knowledge, does not negate a California resident's ability to also get on Medi-Cal?
Correct.
Yeah, so they can get Medi-Cal as well. They can augment. And yet again, you guys are sort of sitting beside as an extra piece.
Yes, sir. Yeah, you got it.
Awesome, man. Well, that's great. And I think we've covered some really cool spots where I think you guys fit in well. Get a hold of Zach if you'd like. Of course, the organization has been not only been a sponsor, but someone that we personally at Montage have worked with in the past. So reach out to either of us if you have any extra questions. That's all the time we have for you this week on the H.I.T Podcast. Join us next week. Join us every Tuesday. And until next week, make this the best week.